Steroids are probably the most misunderstood part of rheumatoid arthritis treatment. You love them on how fast they stop your pain, but you hate them because of the side effects. If you have ever wondered why your doctors keeps on reaching for the prednisone, this video is for you. We are breaking down exactly what they do in your body and why they are usually a temporary relief. Hi, Rheumatoid Arthritis Warrior. This is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc, as well as a practicing rheumatologist here in Cary, North Carolina. Today, I'll give you some insight about the prednisone, the commonly used medication in rheumatoid arthritis. Before I go further, don't forget to like and subscribe to our channel so that you can keep on watching our videos. Also put a comment in our videos so that you can tell us what you like, what you don't like, and how we can improve on our channel. Also, accept our free gifts. That includes a recipe of an anti-inflammatory smoothie that you can prepare every morning to fight against rheumatoid arthritis so that you don't have to reach to the prednisone. And also accept the free copy of the book, the Holistic Rheumatoid Arthritis book that is written just for you. It contains a lot of other information related with rheumatoid arthritis. Now, before we talk more about rheumatoid arthritis, let's also learn more about and recap what is rheumatoid arthritis. As many of you are aware, rheumatoid arthritis is an autoimmune disease where your immune system mistakenly attacks your healthy joints. It causes chronic inflammation, and that leads to persistent pain, swelling, and joint stiffness. And it is not just a joint disease, it's a systemic disease with systemic impact. It can also affect your other organs such as heart and the lungs. That's why it's very important to treat early with early intervention. And when we talk about the treatment, then comes the use of the steroids or corticosteroids. So the corticosteroids are your own body's very powerful anti-inflammatory chemicals, one of them being cortisol. But the prednisone or methylprednisolone are stronger than the cortisol, and they are typically taken as a medication. And what they do, they rapidly reduce inflammation that is happening due to autoimmune disease like rheumatoid arthritis. They also suppress your overactive immune system, which is the primary driver or the primary problem in rheumatoid arthritis. By suppressing that overactive immune system, your body calms down, your joints calm down, causing less pain, less swelling, and less stiffness. But be aware, the corticosteroids are not the same as the anabolic steroid that sometimes athletes might use. They are two different medications. The next question that you might think of is why we use steroid. What is the role of corticosteroid in rheumatoid arthritis? There are two main roles of corticosteroid in treatment of rheumatoid arthritis. And the first one you can see in the screen is called the bridge therapy. You might recall, when you were initially diagnosed with rheumatoid arthritis, you had a lot of pain, a lot of swelling, and your doctor might start you on long-term medication called disease-modifying anti-rheumatic drugs. But the challenge with those drugs is they don't work fast. They take several weeks to even several months, and you are in a lot of pain. So we use corticosteroid to bridge that gap. The gap between when your doctor starts the disease-modifying anti-rheumatic drugs and when they start working, so that you are in less pain. When you are waiting for those medications to kick in, then we use corticosteroid as the bridge therapy. But the important point to remember is corticosteroids should not be used long-term. They are just used during the bridge therapy. The other time that you might also use corticosteroid are during that acute flares. When you are having suddenly increased amount of pain, increased amount of stiffness, we call that flares. So your doctor will prescribe corticosteroid during those flares. And we talked about the bridge therapy earlier. And when you are newly diagnosed, when you are waiting for those disease-modifying anti-rheumatic drugs to be kicking in, then we use this medication. Occasionally, when you have a flare of rheumatoid arthritis affecting one or two joints, your doctor might also inject into those joints with corticosteroids. This is targeted treatment for those specific joints that are inflamed. Doing this local injection steroid, we can minimize long-term side effects. So in general, the corticosteroid could be used in two forms. One is by mouth, the pill form, and also it can be done by injections too. Injection could be your joint or it could be in your muscles. So there are two different ways of giving you the corticosteroids. Beyond the pain relief, here are some of the other benefits with the corticosteroids. One is rapid control of rheumatoid arthritis symptoms. They work fast and help you control your pain much better. Some studies has also shown that corticosteroids do also have joint protection properties, particularly in the early phase of the disease, that can help reduce the joint damage. Because of pain reduction and stiffness reduction, it can also improve your quality of life. You'll be more mobile and more active because of less pain by the use of these medications. Now, here is the important slide that you need to remember. You need to work closely with your rheumatologist and your doctor on how you are taking your corticosteroids. It has to be taken very safely. So always use corticosteroid under close supervision with your primary care doctor or your rheumatologist. And the next important point, never stop corticosteroid cold turkey, which it can cause, we call adrenal crisis, where your adrenal gland might shut down and causing other major medical problems. So if you have concern with the side effects, always discuss with your rheumatologist before stopping corticosteroids. And other very important thing to remember, and other very key concept to remember in corticosteroid is the fourth point. The goal of treatment with corticosteroid is to use the lowest effective dose for the shortest duration of time. So try your best not to use too long or not too high dose. The corticosteroid could be a powerful tool in empowering you in your RA journey. It could be a powerful tool to help you quickly manage your rheumatoid arthritis flares, or it can be a bridge therapy where your long-term medication are not active yet. So use them as a powerful tool and be very strategic on how you are using the corticosteroids. Use them as a bridge, not as a long-term solution. And also work closely in partnership with your doctor so that you take the right dose for right duration of time. So thank you all for Rheumatoid Arthritis Warrior for watching this video. If you like this video, please like and subscribe. Also comment below so that we understand what you like and what you don't like. And then if you like any other topic, do let us know. And I'll see you in the next video. Bye-bye.